Hi everyone, it's Lisa Moeller with MedMark and welcome to another edition of DocTalk. We're in my home today in Scottsdale sitting down with one of our very favorites, Dr. Tom McClammy from North Scottsdale Endodontics and Implantology and Horizon Dental Institute. This is, I think, his fourth visit to DocTalk, and I'm so honored to have him with us again for another chat and glimpse into his practice. Welcome, Dr. McClammy.
Thank you, Lisa.
So
Pleasure to be here.
Great to see you again. Thanks for joining us and coming back and chatting with us on DocTalk. I appreciate it.
Thank you very much for having me here. It's a pleasure.
Thank you. So what is new at your practice? What's going on? There's always something great happening over there.
Well, fortunately, in today's competitive environment, we are remaining very, very productively busy, which is gratifying and flattering in many ways.
Absolutely.
And I'm happy to report that we are adding now a second endodontist to the practice, which is going to be really helpful for me to allow me and to give me permission to spend more time working on challenging cases, working on challenging implant cases, which the more you do, the more challenging they get. The more you know, the more you realize you don't know, the more you realize you need to know.
That's awesome. You're going to have some help there.
Yeah,
because you're so busy.
It's going to be great to have some additional help. Got a very, very well qualified new endodontist joining, so I'm super excited about that.
Great.
And it'll give me more time to teach, and it'll also give me more time to be involved in something that we're going to talk a little bit about today, and that's GentleWave, the GentleWave procedure.
Right.
And I've been really busy with that and seeing some very exciting things clinically.
That's awesome. I know our audience will love to hear all about that. So you also have Horizon Dental Institute. So tell us a little about that and what you have going on there.
Well, Horizon Dental Institute was really a brainchild of one of the reasons that I wanted to relocate to the very location that I am geographically, not only in the United States, but on the West Coast. I was formerly practiced in Bend, Oregon, and in addition to getting to a warmer climate, I wanted to be a place where I felt like doctors would want to come to a destination area, a place where we had nice weather, a place that was served by an international airport that was easy to get to, and an area where I could develop this thing that we refer to now as Horizon Dental Institute. And it has opened up a lot of new doors, met a lot of new people, brought in clinicians from literally all over the world. Our next course actually in September, one of the next courses in September, we actually have doctors coming from Australia. So we've had there from Germany and from Australia and different places in the world. It's neat to be able to provide something that people feel like it's valuable enough to come great distances. We had a doctor there from Ireland. So
wow.
It's pretty exciting.
That's
it's a lot
awesome.
a lot of fun, very gratifying.
Yeah. So how many doctors do you typically have in that course attending?
When we do a hands-on course, we actually have 10 hands-on workstations where each workstation is equipped with a microscope and an ASI delivery unit where we can do microscopic procedures on typodonts. We use Steve Buchanan's True Teeth. We use Steve Buchanan's True Jaws when indicated. And we have 10 individualized workstations, and then there's a doctor instructor station also equipped with a microscope. So I feel like a lot of what we're doing as endodontists and as implantologists revolves specifically around the microscope and being able to see better and therefore do better.
Right. Your center is very nicely equipped there. It's state of the art, and you're doing amazing work. So obviously you've been successful with it. So kudos to you for that. So let's go into the Sonendo GentleWave that you use in your practice and tell our endodontists out there why you use it and why it's so valuable to you.
I like the question because if my father were alive, he'd say, "Son, what are you doing now and why?" And our job, our objective, our mission as endodontics, whether we're a university-trained endodontist or whether we are a general practitioner providing endodontic services, is to clean and disinfect the root canal system to the very best of our abilities. And there's been a myriad of different things that have come along in my lifetime and my career in order to accomplish that objective. And there are things, each one of these things have made it better. I feel like that we are on a game-changing technology and a paradigm shift with the development of the GentleWave console and the GentleWave procedure by Sonendo. I am literally witnessing the cleanest root canal systems I've ever witnessed, no matter what I've used to debride and disinfect the root canal system. Mm-hmm. And with it comes changes on the part of the clinician. In other words, we have to change our thinking a little bit. We have to change what we're doing clinically a little bit in order to incorporate the GentleWave procedure, but the end result is worth the change.
How so change your thinking?
The procedure specifies certain changes of our protocol, and one of those things is we are using fewer endodontic instruments in terms of shaping. Mm-hmm. I think that we need to change our thinking in terms of, are we shaping canals or are we preparing canals? And when in former time for me practicing was the shaping and the cleaning and then filling root canal systems. Mm-hmm. Today, I think that we are creating a pathway to allow the GentleWave procedure to get certain chemicals and irrigants throughout the root canal system and let it circulate through the root canal system and debride it, but it's no longer necessary for us to open root canal systems larger than necessary. So what we're seeing is one of the changes is we can keep the root canal system much more conservative and much more of the original shape that Mother Nature brought to us. Therefore, we're not weakening, we're not removing unnecessary tooth structure, we're not predisposing teeth to radicular fracture, we're sending back to the restorative dentist a more intact tooth that's stronger and cleaner, disinfected, in my opinion, far better, and a better prognosis for that tooth for the long haul. The long haul being the lifetime of the patient.
Right.
So I'm pumped about it. I'm excited about it. I'm thrilled to see what we're doing and what this technology is allowing us to do.
And the overall happiness of the patient.
Yes, one of the things that we're doing with our patients is, in a consultation appointment before we even do treatment, we're letting our patients know what we're going to be using in terms of the GentleWave procedure, and we actually hand them a card and encourage them to go to the GentleWave website, gentlewave.com. There's a patient portal. They can go and they can see, and patients that have already had a root canal in the past, they will experience this different procedure, and then they will wonder, well, gosh, what about the other root canals that I had done? How are those teeth doing? So they see that there's a difference, and most of the time it's met with renewed enthusiasm and excitement and brings the patient more on board with their treatment.
Right, which is important. I mean, just getting them through the whole process, because we all know root canal is kind of a dirty word.
Root canal, when a patient's told that maybe their tooth needs a root canal, it's not usually met with, oh boy, I've always wanted to do that.
Yeah, exactly. So I know that Sonendo is also marketing to the general dental practitioners. What are your thoughts on spreading this message to that community that's a non-specialist, non-endo specific community?
That's a very good question. It's a thought-provoking question. And it's my understanding that when Sonendo first started marketing the GentleWave procedure to clinicians, their primary target was endodontists, and that still will be that way because the endodontists are recognized as, quote, root canal specialists, and that's fine. But there's a large number of endodontic procedures that are done any given day all over the world, and they're provided by the general practitioner. It's legal, it's ethical, it's moral, it's honest, And many times the general dentist is the first one that sees the patient. I am fully on board with general dentists providing endodontic services. I do not have a problem with that. Obviously, we see a lot of patients that come back at different times where a root canal has been done somewhere in the world, sometimes by an endodontist, sometimes by a general practitioner, and that root canal procedure, that endodontic procedure, might be a candidate for retreatment for a wide variety of reasons. Sometimes it might not even be an endodontic failure. Sometimes it is some other type of failure, and the tooth may be a candidate for either retreatment or perhaps the removal of a tooth and possibly the placement of an implant. But as the GentleWave procedure becomes more well known and more accepted, this is conjecture on my part, by the endodontic clinicians, more general dentists are going to hear about it, more general dentists are going to seek it out, and Sonendo will market, and they are now, and I know general dentists personally that I've already gotten on board and purchased the GentleWave unit. I'm fully in line with that, and I believe that anybody that goes through the time and the necessary training to provide a good endodontic service to their patients should do so. I don't think that the GentleWave unit, the console, the procedure will make general dentists and general practitioners actually endodontists, but it will take all endodontists and general dentists who choose to get on board. It will make them better clinicians because they will be able to do, in my opinion, a much better job, and they will see things and they will be able to do things that they've never been able to do before. And specifically what I'm referring to is creating a cleaner root canal system.
Right, but those are good points. I mean, you know, I obviously have an endodontic publication geared just towards endos.
And your endodontic publication, it's a little stroke for you, is perhaps one of the most useful publications in endo, because it is immediately, for those endodontists that are practicing, it is immediately applicable information. You can pick up that magazine anytime and pick up little pearls in there, little bits of words of wisdom from clinicians all over the world that offer a little something or a little technique that is immediately applicable in your practice. So I love your magazine.
Thank
and
you.
I've participated in your magazine.
Yes,
I think
you
it's
have.
great.
We're very grateful to the articles that you've written and the knowledge you've shared with our audience. It's been, you know, it's been fun, and we've used that terminology. You told me that long ago. You said that same statement to me, and we've used that with.
Well, you know, if you tell the truth, you never have to remember what you said.
That's right.
So
I like it.
It was well said, and I meant it.
Thank you.
I still mean it.
That's a huge compliment to us and our editorial staff. You know, and I've always been, you know, speaking about this topic, I've always been one that's like, you know, you're not going to a foot doctor for heart surgery, right? So, I mean, if I need a root canal and I need something along the lines of, you know, GentleWave with Sonendo, I'm going to an endodontist. You know, and I get that they're marketing to the general practitioners, but it's interesting. It'll be interesting to see, you know, how that plays out.
Well, I think that I firmly believe that the GentleWave procedure will make any clinician who chooses to provide endodontic services a better clinician, without question. That doesn't mean that they're going to become endodontists, although some of those clinicians, just like myself, when I was a general dentist, I got so excited about endo, I chose to pursue it and become an endodontist.
Right.
I miss a lot of stuff about general dentistry. I didn't quit being a general dentist because I didn't like dental. I love dental and I miss it, but I wanted to become an endodontist, and I did that. But I really believe that the GentleWave procedure will make every clinician better, and I believe that patients will benefit dramatically. The referring office, when there is one, will benefit dramatically, and also the staff benefits because they see the immediate difference.
Right. And that's what's most important. serving the patients and making them happy and getting them through the procedure. You know, again, whether it be a GP or an endodontist, as long as the patients are taken care of. And this technology is amazing.
It is amazing. You know, one of my mentors, Herb Schilder, Dr. Schilder, used to say, make yourself the patient and you have the right answer.
Right. That's
so
good.
It'll be interesting to see what transpires with the passage of time, because I've had opportunity and privilege to provide root canal services for many of my colleagues, both dentists and endodontists. And now that GentleWave is becoming more known, I'm just interested to see what endodontists that understand the technology, I'm interested to see when those endodontists show up for a root canal, do they choose to have the procedure done with the GentleWave procedure, or would they prefer it, I'll refer to it in a non-condescending as the old-fashioned way. Mm-hmm. I believe that most endodontists that truly understand the technology will say, I want to have the GentleWave procedure. That'll be interesting to see. I'm going to do my own little personal study on it.
Yeah, that will be interesting. Well, if anyone's going to get the information out there, it's going to be you, for sure.
Been a fun time to do that.
So you also place implants.
Yes, ma'am.
Okay, so I asked Dr. Herbranson about this too, because he's an endodontist
a very good endodontist, by the way. Very talented guy.
Yes, he is.
I love that guy.
So yeah, he's great. So where do you draw the line with endodontics and saving the tooth versus deciding, oh no, I got to place an implant?
Okay. This is a very important question. And the message that has been put on the cover of, say, Dentistry Today is endo versus implant. That's in my opinion, that's not the message that we have. So my goal as an endodontist, as a dentist, is to save the natural tooth. Dr. Schilder told us the ultimate dental implant's the natural tooth, provided that we can keep it healthy. But if we can't keep it healthy, what is the next best thing? I'm a firm believer, and I'm the recipient of it myself, when one of my endodontically treated teeth fractured, meaning the root of the tooth fractured, I went to the dental implant. I personally would rather have a dental implant than I would have the two adjacent teeth modified when possible to put in the 3-unit bridge. And I base that upon almost 40 years of doing clinical dentistry. So I'm faced every single practice day of the week with patients that come in that have had an endodontic procedure done and that the tooth cannot be saved. Most of the time, we find that there's a radicular, or in other words, a root fracture, and the tooth can't be saved. So my personal decision-making process is, not only do I inform the patient of that, but I also document with photography, clinical photography, that this tooth is not salvageable, and we give the patient choices. In other words, it's the patient's choice whether or not we extract the tooth and put in a dental implant. So we give the patient choices, we try to educate that patient. We also, when there's a referring office on board and a referring doctor, we try to draw them into the discussion, because some dentists still like to place the 3-unit bridge. That's fine, that's their decision. Once the patient's informed, they can decide. But my personal thing is, I need to document that the tooth is not salvageable, that it's hopeless, and then with the patient's permission, and when there's a referring office permission, and it's the patient's choice, then we'll remove that tooth and we'll place a dental implant.
Right.
And I firmly believe that endodontists that are trained to place implants and they understand the anatomy and they know how to use a microscope, one of the very best clinicians to place a dental implant is the trained endodontist to do so, for a myriad of reasons.
And you have all these best practices that I know that you utilize yourself, but share some of those with our endodontic community as far as the microscope and the tools I know that you use to treat your patients.
Well, today certainly the technology allows us to be better clinicians, without question. I saw an emergency patient this morning that was sent over by their referring office last night who had a broken implant screws. In other words, this gentleman was traveling from Alabama to California with his wife, retired physician. He broke out his front teeth that were supported by implants, and the patient was sent over by the dentist, and I said, well, I'll see what I can do to help. It was a piece of cake, and the reason why is I understood what I was looking at. I had a microscope so that I could remove the broken screws. I happened to have my contact and my relationship with the Nobel rep who brought over some brand new screws. We disassembled things, we took them apart, we disinfected, we got our laser in there, we removed soft tissue, we put it back together, and that man thought I was a hero, and his wife, after about 20 minutes sitting in the room watching the entire procedure on the video monitor behind me, literally said, "I'm in love with you, dude."
That's awesome.
It was fun.
I bet he
I was a hero for the day.
Oh my goodness. That was all this morning already.
Already this morning.
Wow.
It was great.
That's great.
So, in answer to your question more specifically, the technology today, specifically the microscope, cone beam technology, piezotome surgery, lasers, all of these things allow us, education, allow us to be and to deliver the highest quality dentistry that we've ever been able to do. It's the best time ever to be involved in it. There's no question about it.
It really is. It's exciting. And can you imagine the technology coming in the next 10 years?
I can't. I just,
it's gonna
I
be
never
mind-blowing.
dreamed, if somebody would have told me when I got out of dental school, close to 40 years ago, that I would be doing the stuff that I'm doing today, I would have just like, I can't even imagine it. So where we're going to be in another few years, I have no idea. Where we're going to be next week and next month, who knows?
I know.
We're in the information age, man. The technology is expanding faster than we can keep up.
I know. Every time we go to a trade show, it's something new and better and more exciting, and it's a great time to be a publisher in this industry to get the information out.
Well, and you get to work with a lot of these people that are releasing new technology. That's got to be exciting for you guys.
It's very cool, yeah.
You probably say, "Tell me that again."
We do. It's a lot of it is pretty mind-blowing for sure. So it's exciting. So okay, you've got some courses coming up with Horizon Dental Institute.
We do.
Friday, September 29th, 8 to 5.
It's the Friday, and we have our third Sonendo Horizon Dental Institute one-day course where we're introducing the GentleWave procedure and technology to dentists. We've had dentists and we've had endodontists, and we make no distinction. We open the doors to people that are interested in learning about that technology and learning that technique. We also do a live demo. We do a hands-on for those clinicians that are there. We have the GentleWave units there. We're using them. We're using, again, Steve Buchanan's True Tooth on it. We've worked on that. He's worked on that very diligently to make it work for us and to make it work for him. It's great. And September, we have, I believe, our 6th or 7th cone beam course for endodontists. That's a joint course with myself and Dr. Bruno Azevedo. Dr. Bruno is I should say Dr. Azevedo. I refer to him as Bruno a lot of times and some other names, but he's the primary instructor on that. He's an oral maxillofacial radiologist, and each one of those courses has gotten better. And we've tried to make it clinically applicable so that those doctors that go back to their practices, those things that are implemented and shared, they can immediately make them more worthwhile in their practices. And I know that we've done that because we hear back from these guys. This particular course that's coming up in September, it's actually not only sold out, it's a little bit oversold out. We'll have another one in November, and then we'll set some up for next year. We're also doing some other things with implants and bringing in instructors from different parts of the world. And the problem is not setting up the courses and filling the courses. The problem is when you're a full-time clinician, creating the adequate quality time to actually teach that course. And
Right.
bringing in this new endodontist hopefully will help a little bit in that area.
Free you up to do what
I
you
don't know that it'll
love.
free me up, but it'll
Yeah.
help. It'll help some, that's for sure.
Right. And my friend Dr. DeVito is going to be joining you as well.
He
in the
will
course,
be.
right?
He will be part of the GentleWave course.
Right.
He's taken the cone beam course, and Dr. DeVito, you know, he oftentimes will joke with me. You know, he said, "McClammy, you know, you've cost me a lot of money." I said, "What do you mean?" He said, "Well, now I got a microscope in my practice, and I've got cone beam in my practice, and I've got a Nomad, and I've got all this."
Yeah.
And he said, "I wouldn't have any of that if you hadn't encouraged me to get it." Well, those technology things make us better clinicians. So, but he helps to teach the GentleWave course, and he is a general practitioner that also has GentleWave, and he's doing some incredible endo with it because he
That's
can.
great. Good. So he'll be able to speak to that. So for the solid dates, then HorizonDentalInstitute.com. They can go to your website and find all the dates
That's the best way.
dates and times to get to you guys. Okay.
Yeah.
That sounds good. So in closing, how are all your animals on your ranch? What's happening? What's an update with those guys?
I this morning when I was leaving, I apologized to my 2 healer dogs because I said, "I'm sorry, girls, I got to go to work." And because my wife's out of town right now, she spent a week on the coast, on the California coast, with her sister and her daughter.
Oh, nice.
Which is great for them.
Nice, yeah.
And so my animals at home probably are feeling a little bit neglected because I'm leaving at 6 o'clock, 6:30 in the morning,
Yeah.
and I'm getting home at that time or later at night, and they're a little neglected. But
Yeah.
I'll get some time to spend with them, and Christine will be back tomorrow, which will be great, and they will be all over her. So
Oh, I bet.
yeah, I
It's
love
always
my animals.
it's always sad for the dogs when mom goes away, for sure.
Yep.
I know with mine, when I get back, they're just attacking me.
Yeah.
I can't wait. And your horses, everything's good with
Horses are good, mules good, everything's good.
You've been roping
I
and
haven't.
riding?
I don't rope much in the summertime
No.
unless
Oh,
I
it's
go
a
up to
little-
the
yeah,
high
it's a little
country.
warm for
It's
that
way
right now.
too warm for me
Yeah.
anyway. That will resume in the early fall, probably November
Yeah.
time.
Well, it's been so great to have you here with us again today. Thanks so much for joining us.
Well, again, thanks for having me. It's a pleasure. And it's the first time I've been in your home, so you've got a beautiful place here. You and your
Thank
hubby
you.
have done an incredible job here.
Oh, thank you.
Very, very nice.
We're kind of homebodies, and we like to, it's kind of a little hobby of ours to decorate, and
It's a great hobby to have.
I know, it's fun, for sure. All right, well, we will see you soon. I think I'll have an award for you next time for being the doctor on DocTalk the most.
Oh,
You have the
perfect.
most times with us,
Love
sitting
awards.
down with me.
All right.
It's good to see you.
Thank you very
Take
much,
care.
Lisa.
Uh-huh.
All right.
So that's a wrap for another info-packed edition of Doc Talk. I'd like to thank our special guest, Dr. Tom McClammy, for joining us again. To reach him for more information on Horizon Dental Institute's upcoming courses, please go to HorizonDentalInstitute.com. We'd also like to thank our sponsor, Sonendo, for helping us bring this important information to our endo community. For more info on Sonendo products, please go to Sonendo.com. And as always, for further info on everything endo related, please go to our website and subscribe to our publication, Endo Practice Magazine, at endopracticeus.com. And bonus, you also get CE credits for reading, so it's a win-win. We'll be looking forward to seeing you all again next time for another informative Doc Talk segment. Until then, take care, everyone.